Hello and welcome to our video. Hopefully you find it enjoyable. So the reason why we chose this subject is because there's a lot of misinformation out there regarding pain. Whether it's people who doesn't know about psychosomatic physiotherapy or they just haven't updated curriculum yet. So hopefully we can give some insight into that to other healthcare professionals. As a healthcare professional, we are obligated to give the best available treatment to the patient who need it and also the most cost efficient. In this video, we will explain to you as another healthcare professional what psychosomatic physiotherapy is. We will also explain about the biographical anamnesis, the biopsychosocial module, and also what treatment options you can do in this whole spectrum. There's a lot of things to cover in this subject, so we can't really cover it all, but we will go briefly over small things here and there. Topi.
Howdy, healthcare professionals. So you think psychosomatic physiotherapists just lie around the whole day? Wrong. Let me show you.
Okay, so what is actually PSF? PSF is a specialized domain within the physiotherapy that focuses on various complaints that are related to stress, complaints such as pain, chronic pain, or fatigue, without a clear physical cause. Usually there is an imbalance between the load placed on the body and its ability to handle the load. In PSF, mind and body is highly connected. So as a healthcare profession, it will be useful to know what the psychosomatic physiotherapists are doing in their field of work. There is a bunch of competencies in the psychosomatic physiotherapist. The first competencies is the screening, which the psychosomatic physiotherapists are screening for red flags and also recognizable patterns. And then there is the diagnosis, which consists of examination and anamnestic data. And then there's operationals, the request for help specifies the problem so it suits the treatment better. And then we have the intervention and the preventive interventions. While the intervention is based on a handful of different interventions we can do to solve the problem, while the preventive interventions are more based as families and friends and co-workers and everyone around you has a big role to play in how pain is perceived. It's very important for the psychosomatic physiotherapist to get those parties involved to enhance the treatment process. And the last one is the professional cooperation, very important in a multidisciplinary team.
I'm going to talk about the biopsychosocial model, and as you can already see, it's focusing and enhancing the interactions between 3 different levels of life. That one includes the biological factors, the social factors, and the psychological factors. So the biological part includes the genetics, more critical diseases, and general disabilities. The social model includes family, friends, work environment, maybe school. So you have this big part, and then the psychological part is going to be about more the coping mechanisms and how your character is as a person. The biopsychosocial factors model, which is pretty much similar, and it focuses on the in-between links between the risk factors somebody can have and the prognostic factors. So it starts always with looking at what the risk factors are. There are also the predisposing and provoking factors, such as inflammation, long-term or chronic stress. Due to these factors, you have a disruption here in your immune system, nervous system, or endocrine system. And this leads to a difference leading towards a disease or a problem. Then you have the prognostic factors which come in there, which could be stress, coping mechanisms, or the cognition around the problem. And then you again have a change or disruption of the complaints or the disease. Out of this, you will have either, because of the prognostic factors, you will end up in positive, neutral, or negative outcome of the disease. Then there's also the biographical anamnesis. That one includes just all the old and historical factors of a patient. And what you do is you give insight to your patient about what's there and what's happened in the life, and that already helps the patient to realize and analyze their own problems and work on them.
Hi guys. So for the anamnesis, we're going to focus on more psychological factors. And there's a list of factors you should follow. Here it is.
Where's my bats, man?
Oh. So that was P for pain. And then there's S, somatic and medical factors. And then there's C, Cognition and perception. E. Emotions. I have to play that game. I don't care. B. For behavioral factors. And then there's S. Social factors. And then M. For motivation. And then there's the signs and symptoms. It can be due to a stress most of the time. It can restrain your immune system and also affect your connective tissue. And then there's your level of cortisol. It can be due to a number of things, like the things I mentioned in PSC, EBSM. Finally, a number of things can influence your signs and symptoms. Be fatigue, chronic pain, lack of sleep, some inactivity, being overworked, underworked, that can also lead to a burnout. Also a lifestyle that could consist of always trying to be perfect, overachieving, and finally, a trauma. This is just a few signs of symptoms that can influence your psychological state, but obviously there can be a number of others that I haven't mentioned.
For a treatment option, we can also do pain education, which basically is we're talking about how the brain influences pain.
In patients with pain, perception, emotional behavior can be the most limiting influences. Therefore, pain education focuses on influencing maladaptive perceptions. One common strategy used within pain education is using metaphors. There's a lot of different metaphors you can use, such as the fire alarm, dashboard, energy in versus energy out. The reason metaphors are used is because it's easy to remember and can convey a very powerful message for the patient regarding explaining their pain.
Because sometimes there might actually be pain without any structural damage. And what we use here, we can use two modules, which are evidence-based practice, and basically that's common sense module and fear avoidance module.
So another treatment option we have is the acceptance commitment therapy, which is basically that the patient are accepting their own experience of the symptoms, and we as a therapist will influence what we can directly, and the patient tries to live with the symptoms.
You can also do some relaxation techniques which can reduce stress in order to influence the pain.
Motivational interviewing is a directive, person-centered style of conversation, designed to promote behavioral change by helping to clarify and resolve ambivalence towards change.
Alright, so this was the video about the psychosomatic physiotherapy, and hopefully we learned you enough about what psychosomatic therapy is, and hopefully it was some help for you. And here's the group. Do we?